So Lyme disease has 3 stages. The first stage is acute. The second one is chronic Lyme disease, and the third one is an autoimmune form of Lyme disease. Most people get the acute form and get on treatment. If they get in treatment right away, are able to take care of the illness. Most of the time it's contracted through ticks, but there are a lot of other ways to contract it too. For example, we think my son either contracted it in utero or else through blood transfusions. So other things that bite it can be contracted other ways. So recently there's been some research done on why do some people get the acute form and get over it, and other people get it and they can't get over it. And they found like a genetic base and reasoning for that. And there's a lot of controversy over chronic Lyme disease. And so I kind of, if you don't mind, wanted to give you a little bit of the political background behind that. So there are 2 infectious disease societies. There's IDSA and ILADS. And IDSA is a society that says there's no such thing as chronic Lyme disease. There's something called post-Lyme disease syndrome, and that Lyme disease should be treated with 2 weeks of antibiotics, and that's it. And there's another theory, though, with ILADS, where they say there is a chronic form, that this is a persister drug, and even after antibiotics, it continues. So they suggest long-term antibiotics. So essentially you have 2 societies that disagree with each other in a lot of areas. And currently the CDC supports IDSA's guidelines, which is really interesting because the CDC, a lot of their board members have fingers in a lot of pies with vaccines and a lot of things. So there is a lot of concern with them having dual intentions. So going back to ILADS, I think it's really interesting that the National Clearinghouse Guidelines, which is another government agency that tells doctors how to treat certain illnesses, on their website, they had both ILADS and IDSA's guidelines posted on there. But as of, I believe it's 2014, the IDSA's guidelines expired and they were removed. So, and they also didn't go through the rigorous process of having those guidelines accepted. So ILADS went through that rigorous process. They have a lot of research. Right now we're starting up long-term, really intensive research that shows that Lyme disease is a persister drug or persister bacteria. And on that website, it posts ILADS as the guidelines to treat. But unfortunately, in the mainstream medical system, doctors don't have this updated information. And so that's also why it's really important for me to be able to talk about this, because a lot of people who suffer from chronic Lyme disease are afraid in the ER to say, I have chronic Lyme disease. And so in the medical system, we are treated like lepers. When you have so many medical symptoms, doctors automatically assume that it must be pseudo, not finding the word, that it's in your head. So you have these really, really sick people, and doctors are putting them on antidepressants and things like that. Because if you have this many symptoms and it's ongoing, then it must be in your head, which is, it's really hard to be suffering like that physically and being told it's all in your head, because doctors are just not educated. So we have these people battling for their lives, because this is a bacteria that attacks every organ in the body. It hides out in every tissue and in joints and in the brain. It can be life-threatening if it's not treated. There is no cure right now, and that's really hard for me to say, but it's true. There's no cure. So most of us are just treating the best we can, exploring all options to sustain ourselves until there is a cure that comes out. as we go forward, I mean, there are doctors stepping up, and they really are heroes in our community, and we are so grateful for those doctors. There's a doctor that I recently was reading his information, because I'm always researching and learning and trying to be the best advocate I can for myself. And this doctor was saying he would prefer treating a stage 4 cancer patient before a chronic Lyme, stage 3 Lyme patient any day, because this is such a tricky bacteria, and it damages your immune system. So, for example, I never get colds. Like everybody around me, I can maybe I'll cough a few times, but my body is just already so overwhelmed with bacteria that it can't take care of a cold. And there's something so tricky about Lyme too, because it's not just this crazy, really tricky bacteria, but it also comes with co-infections. So that can look like Babesia, Bartonella, Ehrlichia. There's a list of co-infections that it comes with, because it's like this dirty needle. These ticks bite into you, and you don't just get the Lyme, that you get everything inside of them. So like Babesia looks a lot like malaria, and we know malaria is pretty tricky to get rid of. And then you get parasites. And then when your immune system's compromised, you picked up everything, you pick up Epstein-Barr, cytomegalovirus, and things like that. Whereas other people who with healthy immune systems can fight those things off, people with Lyme's immune systems are just so overwhelmed and even attacking itself that it can't take care of those illnesses. So going back to the bacteria, Burgdorferi, it has 3 life stages, and the problem with antibiotics is you can hit it in one form and it will change itself into another form. So that's why a lot of doctors try to hit it with multiple antibiotics. Other doctors have a different approach. There's the kind of 2 main approaches. You bombard the bacteria and wipe it out, or the other theory is that you and build up the immune system so it can fight it off itself. And for the first 5 years of my illness, I tried to do the immune system part, but it just didn't work for me. So now we're doing more the aggressive attacking the bacteria itself. I kind of think you have to do both. There's a lot of theories about how to treat it. And the hardest thing is that not everyone reacts the same to this. So you have people that can be on the exact same treatment, be sick the exact same amount of time, and some people respond to it and some don't. So we have to that's the tricky part, is you just have to try so many treatments to find out what is going to work for you.